Hi, good morning everyone. I am Rahul Nanwal, COO at Cureka.com, and we are back with our weekly Instagram live session. The topic for our today's discussion is healthy bones and healthy joints. We are going to be joined by a very specialist orthopedic surgeon, Dr. Deepak, who is going to help us understand how to keep our joints and bones healthy. In today's time, it's very important and critical to have healthy joints and joints, because obviously these are the only ones which will help us in mobility and staying fit and staying healthy. So a lot goes behind the mechanics of keeping your bones healthy. A lot of people suffer from brittle bones, or probably some very frequent fractures or hairline fractures or bone health issues, joint pain issues. So we're going to cover most of these topics and to help understand like what we can do in general to keep them healthy. At Cureka, our effort has been in place to help you live a very healthier life. In general, we want that all aspects of your daily healthy life, whether it is nutrition, your healthcare needs, skin care, hair care, they must be taken care of. So in just a few minutes, Dr. Deepak is going to join us. And Dr. Deepak is going to help us understand, how to keep our body fit and healthy, and bones and joints healthy. Good morning, Dr. Deepak. How are you?
Good morning, Rahul. Thanks for the
thank you. Thank you so much for joining us today, Doctor.
So I can give you insights to what all questions we have regarding the bone and joint health. So it's my pleasure.
Thank you so much, Doctor, for taking your time today and joining us and helping our listeners to understand how to keep their bones and joints healthy. So we have got a lot of questions which have come from our free of cost WhatsApp platform that we have on our website, that people keep on asking questions around bones and joints. So the first question which listeners want to know is that what are the best exercises for maintaining bone and joint health?
See, this is a good question. Actually, if you understand the basics of the bone and joint, the physiology and all, the bone is mainly made of the calcium and the other minerals. So there is a continuous process going on where there will be a calcium deposition as well as calcium will be going off from the bone. But whenever there is a high impact exercises or whatever exercises you do, you put a pressure, you put a weight bearing exercises and all, there will be more stress on the bone, and the body will understand that it requires more of the calcium. So it will have a more reabsorption of the calcium from the kidneys. There will be more absorption from the intestine, and it start depositing the calcium into the bone, which will increase the bone density. So the bone quality and the bone strength also increases. So daily there should be the exercises you should do, which may be ranging from simple exercises. If you are not able to start it from a very long time, so you can start with just a basic of walking with the long strides and slowly increase it from half a kilometer to 1 kilometer, 2 kilometer, depending upon your the strength and all. Then slowly you can have a weight bearing exercises. Start just lifting the weights with the dumbbell and all.
Okay.
So that kind of exercises always helps. And if you are more interested in a sports and all, you also can play a small sports with the kids. So that once started running and all, doing football, these kind of things definitely will have a more impact on your bone health. And for a joint, as per, it needs a flexibility. For the joint is protected by the ligaments and the muscle all around. For its flexibility, there should be always a movement. So if you sit at one place for a long time, the joint will go for a stiffness. So the muscle will not be flexible, joint will not be flexible. So every half an hour, every 1 hour you are sitting, just get up from your chair and all for 5 minutes, go around, make just walking, sit-ups, and stretch your body and all, so that all joints will get stretched, the muscles will get stretched, and the joint will become more flexible. It will not have any pain, soreness, or any stiffness kind of.
Right, right, right. Understood, doctor. So, are there any specific foods or diet for promoting bone and joint health, doctor?
As such, we say that for, as I already told, bone is mainly made up of the calcium, and for
Yeah.
calcium absorption takes from the intestine, and for it,
Hmm.
which you will need a vitamin D3 for its absorption.
Okay.
So,
Okay.
vitamin D3 is as such is found in our skin. It needs to
Hmm.
get activated by exposing to the UV light, sunlight.
Hmm.
So the
Hmm.
sunlight exposure may start from 10 morning 10 a.m. to maybe
Hmm.
evening up to 5, but the
Hmm.
highest exposure of UV light takes around 12 to 2 p.m. So
Hmm.
if you have the kind of work you are doing outside and all, the kind of thing
Hmm.
where you can get exposed to the sun, it is a for well
Yeah.
and good, where you can have a more vitamin D formation in your body, which will get
Okay.
activated and it will help in absorption of the calcium. So
Right.
as the calcium-rich products, they are mainly there in the milk and milk products, the
Hmm.
nuts and cereals.
Hmm.
We have green
Hmm.
leafy vegetables. Then
Yeah.
we have the tofu, soya
Hmm.
beans. So all
Hmm.
other things where we can get the calcium. And for vitamin
Hmm.
D3, usually it is mainly present in the non-veg items such as fish liver oil, cod liver oil, or any kind of a fish, even in vegetables. Some of
Hmm.
the nuts also it is available, on oranges it is available.
Hmm.
So you can have a mixture of all these things where it will help vitamin D3 as well as calcium. It will get more absorbed from the body and it will get deposited in the body.
Right, right. Now, doctor, what role? I mean, you have specified and stressed upon a lot of role of calcium. We would like to understand further on this. What role does calcium play in maintaining strong bones, and how much should one consume calcium?
So calcium we need daily from 1000 to
Hmm.
1200 milligram. Again, it depends upon the
Okay.
age and the sex. So if you're of a smaller age, usually it may need around 600 to 700. In the adult
Hmm.
stage, we need 1000 to 1200. So whatever we are
Hmm.
taking, it should be around of a 1000 milligram. For
Okay.
vitamin D3, you usually calculate it into the international units. So again, it
Hmm.
depends upon the age. In the smaller age group, we need it for the 400 international unit, and for
Okay.
adult and to the elderly people, it needs from 600 international unit to the 800 international unit.
Okay.
So calcium is not only important for the bone health, but also for the other things also, because
Hmm.
99% of our calcium is deposited in our bones as a
Hmm.
calcium hydroxyapatite, where
All right.
1% it is free in our body, where it is in the different forms. One is
Hmm.
it is bound to the proteins, especially albumin and
Hmm.
globulin, and in
Hmm.
ionized form, where it
Hmm.
helps for the muscle and the nerve control, for its
Hmm.
growth, for its proper functioning, for proper cardiac function also we need a
Hmm.
calcium. For a nerve
Right.
conduction also we need a calcium. For a clotting of the blood also we need a calcium.
Hmm.
Without the calcium, the clotting mechanism will not work. So these things are there where calcium helps not only in the bone health but also overall health it builds. For that purpose
Right.
also vitamin D3 is also added for that. If you
Right.
see, check most of the blood profile or the test for a vitamin D3.
Yeah.
Now,
Yeah.
the most
Hmm.
of them will have deficiency because they are neither exposed to the sun nor they are taking
Okay.
a vitamin D3 rich foods. So that
Hmm.
leads to many problems in a health related conditions such as they may get a nausea, vomiting, sometimes constipation, some pruritus, some skin allergy, the hair loss will be there. They will have a weakness, they will have a muscle and a bony pain, total body
Hmm.
aches will be there, they may get a sleeplessness.
Yeah.
So many problems are
Hmm.
related with the vitamin D3 deficiency as well. So we need to have a
Right.
proper calcium and vitamin D3 rich foods and try to avoid uh, the oily foods or the junk foods, what we call usually the highly carbohydrated foods or the sugar impregnated soft drinks and all. So these things we should avoid it and add more of the calcium and vitamin D3 rich foods.
Right. Right. Doctor, now there is a question coming in from a listener who says that during the last trimester of the pregnancy, she gets lower back pain, and even if they're taking calcium supplements suggested by the gynae, so how to manage that lower back pain?
See, the lower back pain in a last pregnancy, it is mainly related because of the spine is getting more stretched, even the pelvic
Yeah.
muscles and other ligaments getting stretched because of the volume of the pelvis is increasing. So the weight of the person is also started increasing. There will be more lumbar lordosis. Patient will have more stretching of the ligaments. So because of that, she will be having of a low back ache and all. So she can start doing some kind of basic exercises, what suggested by the gynecologist or some yoga trainer. She can take the help of the yoga trainer or a trainer, physical trainer, and she can have a stretch of proper stretch of the pelvis and the lower back and strengthen the core muscles. So especially the back muscles and all, and try to use the bed which is not very soft, not a foam bed, rather than go for a firm bed. So, which will have a flat kind of thing, and she is better to sleep either on a flat or on the left lateral position, so that you can get a more relief of the back pain.
Understood. Correct. And then I hope this answers your question, Premalata, what doctor has shared. And then moving on to our next question, doctor, how can one prevent osteoporosis and maintain healthy bone density?
See, osteoporosis as one such definition of the osteoporosis is it is a complete deficiency or a decrease in the bone mass density. So the quality, the strength of the bone is completely decreased. So usually one will reach the highest peak of the bone mass by the age of 30 to 35. And for osteoporosis to occur, there are different reasons. To begin with, a genetic condition. If it runs in the family, the people will get it very early. If they have a sedentary lifestyle, if they don't take much of proper diet and proper exercises and all, and they are more addicted to the smoking, alcohol, or some other diseases which will affect the absorption of the calcium, especially the digestion problem or a kidney problem, especially where there is a no formation of vitamin D3. For activation of a vitamin D3, we need a proper function of kidney. So these things will affect the decrease in the bone mass density, and especially the post-menopause. Once the lady reaches the age of maybe 45 to 55, in that range they will start getting that post-menopause, and it will set by 60 years, and they start dramatic reduction of the bone mass. So then they will have a lot of hot flushes. She will have a body pain, muscle pain, all kind of thing will be there. So that leads to the osteoporosis, and for osteoporosis once set in, so there will be a decrease in the bone mass density per year. It will occur, like 1% to 3 to 4% it will happen. So that will prone for fractures. So the bone, as the quality and the muscle density strength becomes less, they are more prone to fracture even with a mild twist, strain, fall like that. So hence it is osteoporosis known as a silent killer, and people are people are not aware of it, and they don't take care of the thing what will happen to the osteoporotic patient and all.
Correct. Correct. Rightly said, doctor. And doctor, there is a question coming in from a listener, Ms. Bhupalan, who says that how to manage that lower back pain, Deepak sir.
Lower back pain, pardon?
Yeah. So I think the listener wants to know how to manage lower back pain. We do not know what is their age or what is their gender, but in general they want to know how to manage.
Yeah. It is a general question like low back pain. For a low back pain to occur, there are many reasons. It depends upon the ergonomics also, and what is your age and all. If you are very obese, if you are not using the proper chairs and all while using your work and all, and that may create a low back pain, or it is because of the injury. If they are involved into the hard works or a kind of a sports involvement and all, training exercise and all, they may injure the ligaments and a muscle. That may be also one of the reasons for to cause a low back pain. And in case of ladies, especially in the age of 40, 50, post-menopause, or in elderly, maybe around after 60 or 70 years, the more chances of osteoporosis, there is a bone mass density goes on decreasing, and they will get a silent, that is a stress fracture kind of thing, where the height of the vertebrae goes on decreasing, they will have a compression fracture, and slowly there will be the kind of deformity they will be noticing, and every time they move, they will have more kind of a pain. So for such thing, we need to have a proper examination of the patient by the proper spine surgeon or orthopedician. Then we need to test it for some of the markers for osteoporosis, such as calcium, vitamin D3, then alkaline phosphatase, parathyroid hormones. Then go for some X-rays, and the best standard gold diagnosis for osteoporosis is the DEXA scan, where you can assess your bone density, where you are either into the osteoporosis stage or you are in the pre-or osteopenia stage, whether you are progressing towards the osteoporosis. So if you are into the osteoporosis, then definitely you need to have all kinds of a treatment.
Wonderful, doctor. I'm sure that's going to help Mr. Bhupalan. I think they have mentioned that their age is 31, so that covers the answer. Another question coming in from a listener, doctor, Shankar Bhuvneshwari. She's asking, is vitamin D mandatory for menopause stage women to improve bone health?
Definitely, definitely. As I said, vitamin D3 is very much required for the absorption of the calcium. If you take calcium of 1000, 2000 milligram also, if you don't have a proper vitamin D3 in your body, the all calcium gonna go waste and get excreted from the body. So if you have a proper vitamin D3 in the body, in the form of a proper sun exposure, within the body only it is forming, then the calcium get absorbed. If it is not in a good quantity, you are able to get the food, especially the vegetarians, they will have a less vitamin D3, and they are more limited to the in-house work and kind of thing. They are not exposed to the sun. Definitely there will be vitamin D3 less. So better to start the vitamin D3 in the range of 400 to 800 milligram international unit. Usually what we suggest them is that 5,000 units per day they need to take, or 60,000 kind of international unit per week we need to give the vitamin D3 for at least 4 to 6 weeks. Once they reach the normal stage of a vitamin D3, then they can have a less amount of vitamin D3, but they need to continue that. So that along with that, we can have a calcium supplement, so that together there will be absorption of the calcium and there is a good bone health.
Understood, doctor. Doctor, there is a question coming in from Mr. Arun. He is asking, hi sir, my mother is 65 years old. She complains of heel pain. She is not overweight, but her teeth is falling. Does it mean calcium deficiency or due to aging?
Definitely. It is together cause. As I said, the age group of 60 years, especially the post-menopause females, and deficiency of the calcium leading to the osteoporosis, and it's a silent killer. People will not come to know. They will all have a kind of a pains in the form of body ache or a heel pain or a back ache or a knee pain kind of thing. And the tooth fall, that is also related to the age as well as to the calcium, because calcium is required for the tooth strength also. So, so definitely you need to undergo a DEXA scan to assess whether she has osteoporosis or not. If she definitely have it, then she need to take care with the other medicines like calcium, vitamin D3, proteins, and other supplements like we give, usually hormone replacement therapies or calcitonin, these kind of things where we can build her bone density.
Understood, doctor. Correct. So, doctor, what are the benefits of weight-bearing exercises for bone health?
I think I have taken up this question before only. I already told that the bone needs kind of always there is a calcium absorption and resorption of the calcium occurring from the bone. So as you put more stress to the bone, there will be more deposition for the calcium into the bone, and it will build up the peak bone mass density, as well as it will add to the quality and the strength of a bone. So definitely we need to have a weight bearing exercises. If you are not able to lift very high weights and all, you can start lifting with a 1 kg or 2 kg dumbbells, or start doing the weight bearing exercises. So like kind of a running, jogging, these kind of exercises will, where the bone will have more kind of a weight or a stress, and it will, body will understand that definitely I need a more calcium, and it will get absorbed and it get deposited.
Right. Right, doctor. And doctor, can you recommend any specific exercises or stretches for joint flexibility?
Basic joint flexibility, we need to stretch all kinds of the joints, ranging from the neck, the shoulder, the back, the elbows, the fingers, the knee joint, hip joint. So if you are having a kind of work where it will be a sedentary kind of a lifestyle is there, or you are sitting on the desk kind of a job you are doing it, for every hour, after every hour, you have to get up and do the stretching for 5 minutes with all the joints. It could be all the joints. You can need to do the stretching, and for that purpose, so many centers are providing the yoga trainer in the in-house offices and all. They will have a trainer where they will allow you to have a kind of proper stretching, and kind of physiotherapist will be helpful, where they will suggest you depending upon your age or any kind of a diseases or any kind of this one is there. So they will suggest what kind of stretches you need to do. But basic stretches you need to do of all the joints, so that if you sit for a long time, all the joints will go for a stiffness and they will go for a soreness. For a joint to have a proper function, so one needs to stretch it so that there will be more blood circulation, there will wash out of the other excretions, and there will be more nutrients supplied to the joint. So always we need to do the stretching of exercises for all the joints.
Right, doctor. Thank you for sharing this information, doctor. And then moving on, doctor, what is the role of yoga in joint and bone health?
Yeah, yoga definitely, it's a one form of training exercises, especially popular in India. Now it is become popular in all over India, all over the world as well, because as a yoga day we celebrate. And recently, our PM Narendra Modi has celebrated Yoga Day in US.
Yes.
And see, the yoga, the kind of thing, it will have the kind of stretches what we do in a yoga. There will be a controlled muscle stretching or a flexion will be there. So you can have a control over it, how much you want to flex it or how much you want to relax it. So this helps in the stretchability of the ligaments, tendons, and the muscles, and joint becomes very flexible. The body becomes very flexible, and even the spine becomes straight here, and people will have more focus, and they will not get kind of a weakness or the kind of boredness. They will have more concentration in any kind of work. So the yoga definitely helps, but you should do it not under the yoga trainer, rather than doing it by doing on your own things and all. With the help of the yoga trainer, you do the yoga, definitely it is going to help and cure most of the basic kind of back pains, the knee pains, the kind of coordination you will not have it. That definitely you will get the coordination between the walking kind of thing, especially in case of those who have got weaknesses and all. So these things will definitely improve with the yoga.
Understood, doctor. Doctor, there is a question coming in from a listener, Nishant, and he's asking, I'm an IT professional. I do neck stretches, but still get neck pain. I don't use pillow to sleep, using good ergonomics. Do I need any supplements?
For a neck pain, I think you will be working continuously on the laptops or computer.
Yeah.
So sometimes there will be eye strain will be there. So because of that, there will be a tension headache, and all other muscles around your neck and shoulder will be very stretched and tensed. So you need to have a relaxation therapy. So in the relaxation therapy, yoga definitely helps. The meditation will help. And if you have specs you are using, if you have any change in the number of the specs and all, better to check with the ophthalmologist, optometrist, and change that specs, and try to avoid using laptops or computers continuously, even on the mobile. Try to reduce your screen time. Try to use the blue filter as well, and try to keep whatever work exactly in front of your eyesight at your the height of your head. Should not be stretched more, either by looking up or looking down or looking sideways continuously. And as I told, if you are doing it for 1 hour work, take a break for 10 minutes, try to do the stretching, and while sleeping you can either use a small pillow, or you can use a cervical pillow where it will have a proper curvature, and try to use the firm bed and try to sleep in a proper position. So definitely definitely these things will gonna help you to relieve your neck pain. Still, you have a problem, then you can consult the doctor where you can take the X-rays and other investigation to properly assess what the problem you may be having.
Right. Understood, doctor. I think that's going to help the listener a lot. I believe that answers your question, Nishant. Moving on, doctor, can orthopedic support devices like braces, they help to improve joint pain?
Usually, we don't advise the braces or any kind of support for joint pain, but usually those who are aged around 60, 70 years and those who are osteoporotic kind of thing, and they need some support, some kind of support for their walking and all. So definitely we can advise them to have a walking aids, maybe in the form of a tripod or a walker or crutches kind of thing if they need. And the kind of support what I advise them to use is kind of a hip support or a knee support where they may tend to fall, or if they're traveling outside and they're traveling without any proper assistance and all, the better to use them for just for a supportive purpose. But this support is only for a time being and a temporary, and it is not going to completely heal the knee pain. And the continuous use of these braces, what will it will cause is it will take the work from your muscles. The muscles start getting less work, so they start atrophied. So they won't work at all, and they will cause more kind of a stiffness or a flexibility will be lost. So this is only for a temporary purpose. While they are traveling, they can use it, but otherwise it is not advisable to use all this one, and it's not going to reduce your knee pain.
Understood, doctor. Yeah, so doctor, there is a question coming in from another listener, Miss Subi. She's asking, I use homemade protein powder with all sprouted millets, pulses and grains. Every day I give this to all my family members, but still my father-in-law, whose age is 56, gets knee pain. He doesn't have diabetes or BP. So any supplement you'll recommend, or what would you recommend for him?
Definitely protein is needed for the growth and proper maintenance of the body. As you said, you are using all kind of millets and the protein supplement. Definitely it is needed for the osteoporosis also. Along with calcium, vitamin D3, we advise them to use a protein milkshake or a protein kind of powder where they can add it to the milk and have it. So in addition to that, if they are not taking any calcium or vitamin D3, better get it checked once what is the calcium and the vitamin D3 status, and then you can start on the calcium and vitamin 3 for 1 month. So you may continue up to the 3 months, and later you can give a gap of 1 month and again restart it. So I suggest better check it once, and then you better start with the supplements.
Sure. I'm sure that's going to help Subi a lot. So with this, I would like to thank you, doctor. I think we have come to a conclusion. We have come to the ending of our today's Instagram live session. I'm sure this is a lot of help for all the listeners across India who are listening to us. We're going to publish this across our YouTube channel and Instagram. So guys who have missed out on this and they want to get their queries resolved, you can come back to us, mention your queries in the comment section below, and we will request the doctor to answer your queries and come back to you. Please do check in Cureka.com. We have got more than 7,000 products listed under 500 different brands. Free of cost WhatsApp platform to help you understand your queries, your healthcare concerns. And we have also launched our new Bangalore Indiranagar Cureka store. So do visit if you're there in Bangalore. Let us know your feedback. Thank you so much, doctor, and we wish you a very happy weekend, and we look forward to connecting with you again.
Yeah. Thanks for giving the opportunity. I thank Cureka and Mr. Rahul and Dr. Satish sir for giving me this opportunity to have interaction with the other patients and on a live Instagram session. And I will be happy to come back next time with more questions to take up. So thank you, and
absolutely
be healthy. Thank you. Thank you very much.
Thank you so much, doctor. Have a good day, doctor.